Welcome to the deep dive. Today, we're tackling something I know worries a lot of pet owners, keeping our furry friends healthy.
hmm
Specifically, we're looking into eosinophilic gastroenteritis, EGE, for short in dogs and cats. It's really about understanding, why their tummies might get so inflamed
And
sometimes.
we're using canine and feline eosinophilic gastroenteritis as our main guide for this.
Exactly. So our mission today is to pull out the key stuff about EGE, like what is it really, what kicks it off, how do vets figure it out, and what can actually be done. We want to give you a solid understanding without, drowning you in jargon.
Yeah, because it's definitely worrying when your pet's not well.
The goal here is just clarity, really, useful information.
Okay, let's dive in. First things first.
Yeah.
What is eosinophilic gastroenteritis? What's going on inside their gut?
So in simple terms, EGE is an inflammatory disease. It targets the stomach and the intestines.
Inflammation. Okay. And the defining feature, the key thing, is seeing a whole bunch of eosinophils. That's a specific kind of white blood cell infiltrating, moving into the lining of the GI tract.
So like an invasion of these particular immune cells where they shouldn't be in such high numbers.
That's a good way to put it. Usually they gather in this layer called the lamina propria, kind of just below the surface lining, but sometimes it can go even deeper than that.
And why is that a problem? What do these eosinophils actually do that causes trouble?
Well, the thing is, eosinophils carry these tiny packets, granules, filled with different substances. When they get activated, they release this stuff.
Okay.
And those substances can directly damage the surrounding tissues. This tissue damage then triggers, more inflammation. It can become this self-perpetuating cycle.
Wow, that sounds frustrating. A runaway reaction almost. So what starts it? What's the initial trigger that calls these eosinophils in?
It often begins with something called an antigen. Could be anything from stuff in their food, maybe pollen they swallow, or even parasites. These antigens can activate another immune cell type mast cells. Think of them as like the first responders.
Okay, so the antigen triggers the mast cell first responder. Then what?
When the mast cell gets triggered, it lets loose a whole cocktail of chemical signals. And here's the key bit. Some of those signals act like a specific call-out, attracting eosinophils to that exact spot.
Ah, so the mast cells are waving the eosinophils over.
Precisely. And then, once the eosinophils arrive and start releasing their damaging contents, it gets even more tangled. The eosinophils themselves can actually stimulate the mast cells again.
Oh, really?
Yeah, causing the mast cells to release even more inflammatory signals. So you get this vicious cycle where the inflammation just keeps feeding itself.
Goodness. It's like the body's defense system gets jammed in the on position, sending out responders who then make the problem worse in the gut.
Hmm.
Now, we're mostly talking stomach and intestines, right? Does EGE affect other areas?
Yeah, the main hit is definitely the GI system, stomach, small intestine usually.
Ugh.
The large intestine can get involved too sometimes.
Oh.
But when we talk about cats, there's something else important to mention. Hypereosinophilic syndrome.
Hypereosinophilic syndrome. Sounds serious.
It can be. While it definitely affects the cat's GI tract, it can also impact other organs, like liver, spleen, kidneys, adrenal glands, even the heart. It's more systemic, widespread.
Whoa. Is that common in dogs too, that multi-organ thing?
It's actually quite rare in dogs, this systemic form.
Hmm.
Our source does specifically mention Rottweilers as a breed where it has been seen, though.
Interesting.
So, yeah, usually EGE is gut-focused, but especially in cats, you have to consider this potentially broader picture.
Gotcha. Okay, so who tends to get EGE? Are some pets more likely? Certain breeds or ages?
Well, the source suggests it's seen more often in dogs than in cats.
Okay.
It also seems less common than another type of inflammatory bowel issue called lymphocytic plasmacytic gastroenteritis. And interestingly, sometimes vets find a mix of inflammatory cells, not just eosinophils, but lymphocytes and plasma cells too.
Huh. So it's not always just eosinophils causing the trouble.
Exactly. It can be a mixed bag sometimes. Both dogs and cats get EGE, obviously. But for dogs, there do seem to be some breed predispositions.
Oh yeah, which ones?
The source lists German Shepherds, Rottweilers, like we just mentioned, soft-coated Wheaten Terriers, and also Shar Pei. They might be a bit more prone to it.
Good to know. And age-wise, is it a puppy kitten thing or older animals?
In dogs, it's most common in pets under 5 years old. But the source is clear. It can happen at any age, really.
Yeah.
For cats, the median age seems to be around 8 years, but they've seen cases from like 1.5 up to 11 years old.
So quite a range in cats.
Yeah. And interestingly, no mention of males or females being more at risk. Seems equal opportunity there.
Okay, so it hits various ages, some breed leanings in dogs. What about the signs? What would a pet owner actually notice that might point towards EGE?
The signs often look a lot like other causes of gastroenteritis. Pretty nonspecific, unfortunately.
Like what?
Things like intermittent vomiting, maybe small bowel diarrhea, which tends to be watery, sometimes more frequent BMs,
Right.
loss of appetite, or just being pickier, hyperexia, and maybe weight loss over time.
So standard sort of upset tummy signs. Anything more distinctive that might make you think EGE specifically?
Well, there's one interesting detail mentioned for cats. In one study, apparently about half the cats with this eosinophilic inflammation had blood in their stool.
Oh, wow. Like fresh blood or darker?
Could be either hematochezia, which is the fresh red blood, or melena, the dark terry kind.
Okay, that's definitely something for owners to watch for. What might a vet find on a physical exam?
In cats, they might actually feel thickened bowel loops during an abdominal palpation.
Right.
They might also note weight loss, of course. And if it's that Eosinophilic syndrome we talked about, the vet might find enlarged lymph nodes or maybe an enlarged liver or spleen.
So the clues can range from pretty general gut issues to these more systemic signs, especially in cats. Okay, this leads to the big question. What actually causes EGE? What are the triggers?
Yeah, this is where it gets a bit murky sometimes. There isn't always one clear answer. The source lists a few possibilities.
Okay.
One big category is idiopathic, meaning, frankly, we don't know the specific cause. This is often what we land on after ruling other things out.
A diagnosis of exclusion.
Exactly. Other potential causes include parasites. That's a big one to rule out. Then there are immune-mediated reasons.
Like allergies.
Precisely. Food allergies, maybe adverse drug reactions, or sometimes it's linked with other types of inflammatory bowel disease. Then you have rarer things like systemic mastocytosis, the hypereosinophilic syndrome itself, even eosinophilic leukemia, or something called an eosinophilic granuloma.
Wow, it's quite a list. Parasites, allergies, weird syndromes, even cancer. Lots of different paths to this eosinophil buildup.
It really is. And that's why pinning down idiopathic EGE means the vet has done their homework.
Right.
They've looked for parasites, multiple fecal tests, maybe deworming just in case, even if tests are negative.
Makes sense.
And getting those intestinal biopsies is crucial to tell EGE apart from other inflammatory conditions. Plus, dietary trials are key for investigating potential food issues.
Right, that process of elimination again. Okay, let's talk diagnostics. How do vets actually confirm it's EGE? What tests are involved?
It usually starts with the basics, blood work and urinalysis. So a CBC, blood count polyp, a chemistry panel, and checking the urine.
And what might pop up on those initial tests?
Well, the CBC might show high eosinophil numbers in the blood, what we call peripheral eosinophilia.
Might? Not always.
Not always, no. It's apparently more common, more pronounced in cats, especially those with hypereosinophilic syndrome.
Okay.
The chemistry panel could show low protein levels albumin, especially if the gut is damaged enough to leak protein.
Right, protein-losing enteropathy.
Exactly. And with that hypereosinophilic syndrome, you might see high liver enzymes or kidney values too. The urinalysis, though, usually normal.
So blood work gives hints, but it's not a definitive diagnosis on its own.
Definitely not a slam dunk, no. Other lab tests can add pieces to the puzzle, like a buffy coat smear looking at concentrated white cells to check for systemic mastocytosis.
Okay.
We might also check vitamin levels. Low cobalamin, vitamin B12, can point towards disease in the ileum, the last part of the small intestine. High folate might suggest bacterial overgrowth in the small intestine.
Interesting clues. What about imaging? X-rays.
Ultrasound.
Regular X-rays, plain films, aren't super helpful for EGE itself. They're more useful for ruling out other things, like did the pet swallow something they shouldn't have? Is there a blockage?
Gotcha.
A barium study, where they swallow contrast liquid, might show thickened gut walls or irregularities, but it doesn't tell you the cause of the thickening.
So not specific.
Right. Ultrasound, though, abdominal ultrasound, that can be quite valuable.
How so? It lets us actually measure the thickness of the stomach and intestinal walls. Plus, we can get a good look at other organs like the liver, spleen, lymph nodes, crucial if hypereosinophilic syndrome is suspected. We can even take ultrasound-guided samples, aspirates, from those organs if needed.
Okay, so ultrasound gives a better look at the structures, but
Yeah.
it sounds like we still need to see the cells themselves for the final answer.
Absolutely. The gold standard, the definitive diagnosis, comes from histopathology. That means looking at tissue samples under a microscope.
Biopsies.
Exactly. Usually obtained either via endoscopy, slipping a camera down or up,
Right.
or sometimes through actual surgery. And if the blood eosinophils are really high, or we suspect mastocytosis, a bone marrow aspirate might be recommended too.
And surgery might be needed if endoscopy can't reach the problem area.
Yeah, or if organs look enlarged on ultrasound and we need better samples. Exploratory surgery gives the best access sometimes.
So what are pathologists looking for in those biopsies? What confirms EGE?
Well, just looking at the tissue during endoscopy or surgery, you might see thickened folds, maybe erosions or ulcers. The tissue might seem fragile, although sometimes it can look surprisingly normal to the naked eye.
Huh.
Similar changes in the intestine. And because the eosinophil infiltration can be patchy, not uniform,
Right.
it's really important to take multiple biopsy samples from different areas. Under the microscope, the key finding is just seeing way more eosinophils than normal packed into that gut lining, the lamina propria.
Yeah.
In severe cases, especially cats, they might be in deeper layers too.
Okay, so seeing those excess eosinophils in the tissue is the confirmation. Got it. Let's shift to treatment. Once diagnosed, how do we help these pets?
For most pets, thankfully, management can happen at home as an outpatient, but hospitalization might be needed initially for the really sick ones.
Who might need to be hospitalized?
Pets with, say, systemic mastocytosis, or those losing a lot of protein through their gut, or if they have other serious illnesses complicating things, basically until they're more stable.
And what kind of supportive care do they get in the hospital?
Standard stuff, really. 4V fluids for dehydration or electrolyte imbalances. If they're vomiting a lot, maybe withholding food for a bit. For those really severe protein-losing cases, we might use special fluids called colloids or even plasma transfusions, especially in smaller dogs, to help keep their blood pressure up.
Makes sense?
Yeah.
Okay, beyond that immediate stabilization, what are the main long-term treatments?
Diet. Diet is absolutely huge in managing EGE.
Okay, what kind of diet?
Usually, we go for highly digestible diets that have limited ingredients. Think elimination diets, where you use novel proteins they haven't had before, or hydrolyzed diets, where the proteins are broken down into tiny pieces the immune system doesn't recognize as easily.
And these diets can actually treat it, not just manage symptoms.
Oh, yeah. They can often get the inflammation under control, achieve remission, and many pets can stay on these diets long-term for maintenance. Sometimes diet alone is enough.
Can you give some examples, like brand names people might hear?
Sure. For dogs, you might hear about Hill's DD or SISD, Purina HA, Royal Cane Hypoallergenic, maybe IAM's Response FP or KO. Sometimes vets help formulate specific homemade diets too.
And for cats?
Similar options. Hill's ZISD or DD, Purina HA, Royal Canin Hypoallergenic, IAM's Response LB. Lots of choices now.
What about those really specialized diets mentioned in the source? Monomeric, elemental.
Yeah, monomeric or elemental diets have nutrients in their absolute simplest forms. They might be considered for pets with really severe inflammation, especially if a food allergy is strongly suspected and they're not vomiting, but honestly, they're rarely needed.
Okay.
And in super severe cases with massive protein loss, IV feeding total torrential nutrition, or the TPN, is a theoretical option, but again, not common. It's also interesting that while we think food trial for allergies, the source implies it's not always the first step for EGE itself. The specific diet choice is often part of the initial therapy.
Right, so diet is key. What about medications? What drugs are used?
Medications are definitely a cornerstone too, especially glucocorticoids, steroids. Prednisone is the main one, yeah. Usually started at a fairly decent dose, maybe 2 to 4 milligrams per kilogram per day, given by mouth. For big dogs, there's often a max daily dose, like maybe 50 milligram total, even if their weight calculates higher.
Okay.
And the crucial thing with steroids is the taper. Once the pet improves, you have to reduce the dose slowly, gradually, like maybe cutting it by 25% every couple of weeks, then even slower at low doses before trying to stop. Taper too fast, and the symptoms often just flare right back up.
That slow taper is really important then. Are there other drugs used besides prednisone, maybe to reduce the steroid dose?
Yes, exactly. Sometimes other immunosuppressants are added to help spare the steroids, reduce their side effects long term, or if steroids alone aren't quite cutting it.
Like what?
Chlorambucil is one, often started daily for a week, then maybe every other day. Some recent info suggests maybe adding chlorambucil is better than adding azathioprine in some IBD cases, but that's still being explored.
Azathioprine, that's another one.
Yeah. Azathioprine is another option, often considered if there's a strong suspicion of an immune cause, and the response to diet and pred isn't enough, usually given daily initially, then maybe every other day. It can take a few weeks to see the full effect, though. Vets generally try to avoid using, 3 immunosuppressants all at once.
Makes sense. The source also mentioned butzenide.
Ah, yes, butzenide. It's another steroid, also oral, but it's designed to act more locally in the gut. It gets broken down significantly by the liver after absorption, so less systemic effect than prednisone.
So fewer side effects, maybe?
Potentially, yes. It's used in both dogs and cats for IBD, including EGE, but it's not completely without systemic effects. Some still gets absorbed. Dosing is often based on body surface area, and for small dogs, it might need to be specially made, compounded, to get the dose right. Cats and tiny dogs usually get a lower daily dose, again with a slow taper. The ideal dosing isn't always perfectly defined by huge studies, though.
Okay, several drug options, but I assume they come with risks or things to watch out for.
Absolutely. Always have to consider other health problems the pet might have. Prednisone, and less often butzenide, can risk GI ulcers, so sometimes stomach protectants are added, though they don't necessarily prevent ulcers.
Right.
The big ones, with azathioprine and chlorambucil, are potential bone marrow suppression, reducing blood cell production. That's why regular blood tests are essential for pets on these drugs. Azathioprine, in particular, is usually avoided in cats because they're more sensitive to this.
Wow, okay. Close monitoring needed.
Definitely. Monitoring liver and kidney function is important too. Other possible side effects include pancreatitis, liver issues, or just loss of appetite. The source didn't flag major drug interactions or list many alternative drugs beyond these main ones.
So careful monitoring is absolutely key with these meds. What does the follow-up typically involve for an EGE patient?
For severe cases, checkups might be quite frequent initially. Monitoring that peripheral eosinophil count can sometimes help track response. The steroid dose gets adjusted based on how the pet's doing, their clinical signs, sometimes blood work too.
And for milder cases.
Maybe checkups every few weeks at first, then less often as the steroid dose comes down. And again, for pets on Adaza or chlorambucil, those regular blood count checks are non-negotiable. But if treatment is successful and they come off meds, long-term follow-up isn't always needed unless symptoms recur.
Can EGE be prevented? Anything owners can do.
Well, if a specific food trigger is identified, then yeah, strict avoidance of that food and sticking to the prescribed diet is the main preventative strategy.
Okay. What about potential complications from the disease or the treatment?
Sure, severe chronic EGE can lead to significant weight loss and debilitation. And then you have the potential steroid side effects we know about: increased thirst, urination, appetite, panting, maybe thinning skin long term. And with the other immunosuppressants, it's that risk of bone marrow issues, pancreatitis, liver inflammation, or anorexia.
Right. So weighing the risks and benefits. Finally, what's the general outlook, the prognosis for pets with EGE?
For most dogs, the prognosis is generally pretty good. They usually respond well to the combination of diet and steroids.
That's encouraging.
It is. Cats, however, the source suggests they often have a more severe form of EGE. Their prognosis can sometimes be a bit more guarded compared to dogs. They might need higher steroid doses, maybe for longer, to get things under control.
Okay. So potentially tougher for cats. But overall, it sounds like while EGE is serious, especially in cats, many pets can be managed well with the right plan.
I think that's fair to say. It's this inflammatory condition, eosinophils in the gut, triggered by various things, often immune-related. Diagnosis means ruling stuff out, usually needing that biopsy. And treatment focuses heavily on diet and immunosuppressive meds like steroids.
And definitely reinforces the importance of working closely with your vet, sticking to that treatment plan.
Absolutely. You know, it makes you think, if immune reactions like food allergies are involved here, what other, maybe more subtle environmental things or dietary components could be influencing these inflammatory conditions in our pets, beyond the obvious allergens? Could there be room for even more personalized approaches down the line? More research into those nuances? It's definitely food for thought as we keep learning about these complex gut issues.